Welcome to this Oncology Data Advisor interview. This week, we have another edition of our Oncology Nursing Month series, where we're featuring a different oncology nurse each week and hearing about their work and research. Our guest today is Gilanie De Castro, who is a nursing director at City of Hope National Cancer Center, and she's here to tell us some more about the role of nursing advocacy. Gilanie, thanks so much for coming on today.
Oh, it's a pleasure. I'm happy to be back with you, Kara.
Yes, excited to talk with you again, too. To start off, I'd like to first off introduce yourself and share a little bit about what you do.
Sure. I've been an oncology nurse for almost all of my career, so over 2 decades, and I really love oncology nursing. It's my passion. I've been in several different roles from frontline nursing at the bedside, infusion nursing, and in recent years, I've been in nursing leadership, which I've really enjoyed doing as well. So I'm at City of Hope, where nurses are wonderfully supported and really great, robust leadership team there. But also, I'm the current president of the Greater Los Angeles chapter of ONS, and I've been part of GLA ONS for several years. So I have a great board and membership that I work with too.
That's amazing, and looking forward to hearing some more about your work today in nursing advocacy.
Yeah.
So to start off, I'd like to first tell us what exactly advocacy means within the field of nursing.
Sure. And this may have been mentioned many times in many places, but nurses are natural advocates. I mean, this is what brings us to the profession. We take care of our patients, we take care of the population we work with. And in order to provide the best care possible, we advocate for their needs in different spaces. So whether it's to the doctor who writes the order for a plan of care or medication or social work or even advocating for the patient at home. That is something that, within the heart of nursing that we naturally do. So I believe that there's that definition of advocacy for nursing, but in recent years, it also has expanded, in my mind, to beyond the bedside or beyond the clinic or hospital walls to advocate for our patients and our profession in local, states, and even federal government.
That's really amazing. Thanks for explaining.
Sure.
How
Yeah.
did you first become involved in advocacy, and what are some of the areas that you work in?
Sure. So I have to say, like in this formal journey of advocacy outside of the natural realm of doing what we do for patients, it started after the pandemic, realizing that nurses have to take a, a, a more prominent role in leading health policy, protecting our patients, advocating for our patients' needs outside of our traditional role in the hospital, but also advocating for the needs of our profession so that we have the tools we need to provide care for our patients or do the best for our institution. So right after the pandemic, when I think there was a glaring realization on my part that there's a huge gap of what happens at our work or what we do with our patients and the policies that are the policies that are being put out by the government that directly influence our work. So knowing that many nurses didn't realize that connection, that really prompted me to wanting to learn more. And that journey took me to meeting more nurses who were interested in the realm of advocacy and advocating for their communities. And just really being excited that there are opportunities for nurses to use their voice and to have influence further than that. So I joined a lot of nursing organizations, especially with ONS. They have a very strong advocacy program that they offer the members, and they have the director of government affairs, and they partner with lobbying firms in order to advocate for oncology patient needs. So I learned a lot from them as well, and realizing there is a lot of work to be done, and there are more nurses needed in that space.
Absolutely. And I'm glad you mentioned that the directions for advocacy are, first of all, advocating for patients, but also for the profession. It's definitely
Yes,
needed in both areas.
yes, absolutely. Yep.
So, as you mentioned ONS, I know you were recently at the ONS Congress in Denver, and that there was
Yes.
some sessions there focusing on advocacy. What were some of the presentations there about?
It was wonderful to connect with a lot of well, not just my oncology colleagues, but also in California, we formed a grassroots organization made up of different oncology nursing chapters where we do a state level Capitol Hill Day, so it was great to connect with them. But we learned about advocacy updates through ONS, like the kind of legislation they're following. Eleni Bolanos is the director of government affairs at Heart Health, who partners with ONS. So she was able to give an update to the audience. Also, there was a roundtable where that focused on advocacy. And so my colleagues that are part of this grassroots oncology advocacy in California, they helped run that roundtable. And it was just interesting to hear the needs or the interest from other states where chapters wanted to make an impact or get involved in advocacy. So I know that members from that roundtable shared best practices. I was also part of a panel that spoke about what we were doing at our local chapters or in our state when it came to advocacy. And it was an honor. I presented with one nurse from Ohio and another nurse from New Jersey. And we talked about, like, at the local level, how we were making an impact. So whether it's the chapter having a government affairs chair or liaison, or actually doing like a lobby day or a hill day to engage members. It was really nice to hear that there are things being done across the country, but also I think it also highlighted the need that we need to do more things across different chapters and states.
Definitely. I'm sure it's really empowering to have so many people who are so passionate about advocacy in one place during ONS. So
Yes.
you
Oh,
can
yes, always. Yeah.
learn and be inspired by each other.
Mm-hmm.
So for the nurses who are watching this video and decide that they might want to get involved in advocacy, where would you recommend they begin?
Well, if you're part of a professional organization, I think that's always a great place to begin. So whether if you're part of the Oncology Nursing Society or American Nurses Association has state level organizations as well. So I'm very active with my state chapter of our state level organization of American Nurses Association in California. And you know, their focus really is on advocacy and how they can support the profession within the states. But I always recommend just the most meaningful thing is to understand how your local government works, how your community works. So, you know, if you haven't gone to a city council meeting or a town hall, I think those are always interesting, and sometimes you can join them virtually because those are the people that are making decisions in your city or your community, or even just knowing how the school board runs, especially if you have children in school, like knowing what the decisions are that are influencing the curriculum at your school or how these decisions are made. So I think that's always a great place just to start and gaining interest that way, because those are, again, the local policies that are going to have an immediate impact on your day to day.
Definitely. It's a great starting point to start local and build up from there.
Yes. Yeah.
Great. So how do you personally fuel your passion for advocacy work and stay motivated?
I think again too, when early in the pandemic, one of the reasons I got into this is I was a newer leader, and knowing that there was very little that nurses were doing to influence health policy, or that the decisions that were being rolled out by the organizations or even at the state or federal level, sometimes they were being made by people that didn't have a background in healthcare, at least healthcare as I was experiencing it at my level. So I think just knowing that there is a need, knowing that I wouldn't want any nurse now or in the future to have to go through what we went through right after the pandemic, that really fuels me. Just seeing the level of suffering with our patients or even staff, knowing that many nurses left the profession or just became disenfranchised and disillusioned, that really fuels me because nursing really went through like a moral crisis, I would say. And so it's really to do better for our future for nurses, because then, you know, we're ultimately the ones that are going to be at the bedside with the patient. And I want to, this is my role and what I can contribute to make sure that nurses stay strong in the future and really have a voice at the table.
Amazing. As I'm sure, seeing everything on a day-to-day basis really keeps you motivated to keep doing, the best for
Oh,
the patient.
yes.
So, since May, as we mentioned, is Oncology Nursing Month, what take-home messages or advice would you like to share regarding the importance of advocacy in oncology nursing?
So one of the themes I've been really trying to share with my colleagues lately is the power and influence of the nursing voice. And I think that we are very good about utilizing that when it comes to taking care of our patients, like making sure that we're the subject matter experts when we're teaching them about like their discharge instructions or what they should do at home, and utilizing our voice that way. But having nurses understand that they can also translate those skills when speaking up against policies that are not in line with our code of ethics, or policies even at your organization that doesn't seem to support what we need to do to take care of patients. So you're really coming into that knowledge that our profession is the most trusted. So in that there is inherent power, but also harnessing that power to have good influence and good outcomes. So with oncology nursing, we get a whole month versus nursing gets like a week. So I think it's a great celebration of what we do. And especially with oncology nursing, I really think that we are a very privileged specialty, that we get to walk in this journey with many of our patients at the lowest point to their life and seeing them through it. And it's such a transformative experience. And that really keeps also my passion for nursing, is seeing that we can make ripple effects on our patients, who are able to still remain with their families, or, they get to see their grandkids and things like that. So that's something I want to share. Just, nursing needs to realize how powerful they are, and we have a responsibility to utilize our influence in a very significant and impactful way.
Amazing. Yes, it's really wonderful to have this whole month to shine a spotlight on
Yes.
the incredible work that nurses do. And at Oncology Data Advisor, we're so grateful and appreciative to you and all of the nurses for the incredible work that you do to improve patient care. So thank you so much for all of your work in this field and for coming on today to tell us all about it.
Oh, thank you so much for having me. Always enjoy talking to you, Kira.